My name is Logan Chapman. I'm in Sports Medicine 3 at South Lake Tahoe High School. And for this project, I will be building a rehabilitation program for reverse total shoulder arthroplasty. This procedure to replace your shoulder joint with an artificial device usually takes around 2 hours. So your surgeon will make an incision either on the front or the top of your shoulder, and then they will remove the damaged bone and position the new components of the humerus and rotator cuff to restore full function of the shoulder.
On the left is a picture of a reverse total shoulder atrophy replacement in which the ball is attached to the scapula, mimicking the rotator cuff, and a rod is inserted into the humerus with a plastic socket that glides around the ball. The picture on the right is a regular total shoulder atrophy replacement in which the ball is attached to the humerus and it rotates inside the plastic socket that is attached to the scapula. Patients who undergo shoulder replacement usually have arthritis of the shoulder joints or their rotator cuff tendons are torn or gone. So reverse total shoulder atrophy replacement is a better option than the regular one because the rotator cuff muscles no longer function in patients that need it. So the reverse total shoulder replacement relies on the deltoid muscle for movement instead of the rotator cuff muscles. For rehab, phase 1 is 0 to 14 days after surgery. The main goals of this immediate postoperative phase is to protect the shoulder. This includes ensuring wound healing and preventing shoulder stiffness. During phase 1, there is no active motion, and patients should ice 4 to 5 times a day for 20 minutes each session. There are little stretches and exercises to do during phase 1. Elbow, wrist, and hand range of motion is one of them. Pendulum is also another post-operative phase 1 exercise and stretch for the shoulder. Passive flexion and passive range of motion. And shoulder blade pinches. Phase 2 is 2 to 6 weeks after surgery. During this initiate outpatient rehab, the patient will continue to do the exercises from phase 1 and continue to wear the sling. The main goals of this phase are to avoid overstressing, restore full passive range of motion, restore active motion, and reestablish dynamic shoulder stability. During phase 2, supine forward flexion and elevation range of motion will be added to the patient's previous stretching and exercises. If there is a pain in the soft tissue or any pain at all during the range of motion, the patient should make sure to respect it and rest when needed. Phase 3 of rehabilitation for a total shoulder atrophy is 6 to 12 weeks. The goals of the active range of motion and early strengthening phase is to progress passive range of motion and restore active range of motion. And of course, to control pain and inflammation and to protect your shoulder by not overstressing soft tissue through too much activity. What rehabilitation experts look for in phase 3 is tolerance of shoulder passive range of motion and active range of motion in the elbow, wrist, and hand, and also good deltoid performance after the surgery. Patients will continue previous exercises and stretches and add on active range of motion exercises, supine forward flexion, and elevation. The lawn chair progression will be also added to phase 3, sit to stand. Phase 4 is 12 weeks after surgery. The goals for this strengthening phase is to enhance functional use of operative extremity and advance functional activities. Also, shoulder mechanics, muscular, and strength endurance will also be looked at. There's no heavy lifting during phase 3. Patients should never lift anything heavier than 5 pounds. And for therapy exercises, TheraBands are preferred over weights because they are more easily controlled. So there is no sudden jerking or motion also during phase 3, and then ice is as needed after therapy. Once patients have pain-free active range of motion, proper shoulder mechanics, and the ability to do household activities, they will be released from skilled therapy. Phase 5 is return to play. Depending on the sport, the athlete will go through a series of functional exercises and tests to see how well the operative shoulder will do in game-like situations.